Hi, everybody. Dr. Maryellen Tedeschi here, and I'm joined by my lovely colleagues, Dr. Molly Sears and Dr. Shreya Soni. We are here to present to you another important topic in women's health, all about urinary tract infections. So let me pass it on to Dr. Molly, who's going to introduce for us.
Yeah, so we thought we'd start out with a kind of shocking stat, which is 10% to 20% of all women experience a UTI or urinary discomfort at least once a year. So if we look at what a UTI is, it's going to be an infection of your urinary tract. So it can be, anywhere up your urethra to your bladder to your kidneys. It's going to get more severe as it works its way up. The most common pathogen that accounts for 75 to 90% of all urinary tract infections is E. coli. So when we look at, signs that you might be having a urinary tract infection, it can be increased urgency, increased frequency, pain when you're using the restroom, passing a very little amount of urine. So you'll have often like a lot of urgency and you'll feel like you have to pass a lot of urine and then only a little bit comes out. You can also see blood in your urine during more intense infections. And then some women will just experience abdominal or flank pain. Something else to note is like in the elderly, when they're having UTIs, it's very known that they won't experience a lot of the bladder discomfort or urinary discomfort, and it will actually affect more their mental state. So they'll often present with like an altered mental state.
And I just wanted to add, spraying your urine could also be a symptom. Incontinence can also be a symptom. All of those are possibilities. When am I at risk? So there are times across a woman's life when you're at increased risk for UTI. So it could be around sexual activity in your younger years. Your risk increases during pregnancy, and it also increases during menopause. So any times that there are shifts in hormones, there are these increased risk of UTIs. Other risk factors in your life that make you susceptible to a urinary tract infection are if you're on chronic or prolonged antibiotic use without replenishing your gut's micro and macroflora, if you're under a period of stress, your immune system suppressed, or if you have difficulty with blood sugar regulation, diabetes, all of those can increase your risk for getting a UTI. And then some women are born with a shorter urinary tract that puts them at higher risk of UTI. Additionally, different types of birth control will change the flora of your vaginal and urinary microbiome, and they put you at higher risk, as well as oral hormones affect your risk as well. So what could happen if you just dismiss this, ignore your pain, hope it goes away? What happens, and then also if you don't take your full course of antibiotics or antimicrobials, what you set yourself up for is the risk of getting recurrent infections. You set yourself up for chronic pelvic inflammatory conditions like interstitial cystitis. If this infection goes uncontrolled, if you have fever and you're ignoring it, it could lead to kidney damage, especially if the infection travels up from the bladder and into the kidney. And it could lead to complications in pregnancy, or there might be a preterm or early delivery. It could lead to narrowing, so the actual urinary tract could change, and then full-on infection of your whole body. So if you're having a bladder infection, talk to your doctor, get it treated soon, and take your course of antimicrobials as prescribed so that you're done with it.
So that brings us to the next piece. What can you expect at your doctor's appointment? So if you are experiencing any discomfort, like we mentioned, it is very important to go get that assessed and see what might be causing it. So at your doctor's appointment, you will likely leave a urine sample for urinalysis. So this is when we're looking at any white blood cells that might be in your urine, protein, blood. We're looking for the pH. And in some cases, an STI screening might be warranted as well. So if you've had a new sexual partner, or if you've had unprotected sex, STI screening to make sure that we're not confusing this with an STI is very important as well.
Your doctor may send that sample out to get cultured. And so there are different species that can cause infection. E. coli is one. Sometimes it's ureaplasma. So depending on your case, they're going to send out for different types of cultures.
Mm-hmm.
So there are many ways that you can get better, and it's going to depend on the cause for you. Typically, you can get an antibiotic prescription from your doctor. You may not even need to get tested first. It's if you have all the symptoms and you have the risk factors, you might go straight on the antibiotics, expect a 5-day course, and make sure you're replenishing your healthy bacteria at the same time. Naturally, there are a lot of preventative pieces as well. Did you want to say something?
Yeah, I was going to say the preventative pieces, but you already beat me to it. So yeah, we're going to talk about D-mannose and cranberry, which can be really effective in helping to prevent that bacteria from adhering, to the smooth lining of the bladder and the urethra. D-mannose is actually a sugar that's very useful for helping to prevent those UTIs and also to treat them. So these are great alternatives that we can use safely.
And if you're
another piece of it too is making sure that you're urinating when you have the urge. So, people are going more frequently when they have an infection, and so they'll try to hold it, but actually letting your body kind of pass those small amounts of urine can help break those latches from the bacteria of being on the walls, and using things like D-mannose and cranberry to kind of help like weaken those bonds of the bacteria to your cells is important.
And I wouldn't say to go buy a cranberry juice off the grocery store shelf. You have to be really careful that doesn't have a lot of sugar, because if the cranberry juice is full of sugar, they're just going to feed infection more. So you do want a pure product. Read the ingredients, check for the added sugars, make sure there isn't any, and take that. Similarly, there is a number of other herbs. Parsley, for example, is really helpful for the bladder if you're dealing with infections. And dandelion tea could be something we consider. If you have a history of frequent infections, we might consider strengthening your bladder with certain tonic herbs. Corn ZMAs is one. And then if you're in the menopause period and you have quite a few other symptoms like vaginal dryness that are increasing your risk for UTIs, then in very special cases, we might think about intravaginal hormones like an estrogen to support blood flow to the area and healing from infection. Safe sex is really important to prevent recurrence. Make sure you're using good boundaries with your partner. Your partner's health history. Where they've been is going to affect you. So condoms are a great idea if you're trying to prevent recurrence of UTIs and it was tied to a sexual intercourse encounter. And that goes for oral intercourse as well. Like Dr. Molly Sears mentioned, hydration is really important. You do not want to douche in your vagina. Only if you're using feminine products or anything to clean, it should only be on the external vulva. Just like you don't put any products inside your nose, you should not put any products inside your vagina. That's going to make sure you have a healthy microbiome and prevent recurrence of UTIs. A couple other ways to prevent recurrence is if your birth control has hormones in it and it's part of why you're having UTIs, we might change that or talk about barrier versions of birth control. We would look at your general immunity. In some cases, in cases of frequent infections or frequent antibiotic use, it may be important to look at your gut and your microbiome again in making sure you're resilient to infections. And that can even involve screening for certain nutrient deficiencies like vitamin D, vitamin C, that if they're low, that could be why you're having frequent infections. Stress management is another really important piece to prevent recurrence.
So on that note of like kind of zooming out and looking at the body as a whole, when we look at our vaginal microbiome and our gut microbiome, those microbiomes influence what your urinary tract microbiome is doing as well, right? We have ways that bacteria in different parts of our body communicate to each other. And so that's why it's important to make sure that, all of your microbiomes are on track.
Yeah, I don't think we've got enough testing yet for the vaginal microbiome. I know we do the gut, but we're seeing more of that in the future, and it does matter that we all have a different flora in our vaginas, and you can optimize that.
Absolutely. All right. Well, thank you guys so much for joining in today. We hope you're able to learn a little bit about UTIs if this is something that you're struggling with. And if you are in that 10 to 20% of women who get at least one a year, I know personally in practice, I've seen women who get multiple a year, sometimes one monthly or every other month. That is definitely something that a naturopathic doctor can help you with, looking at the big picture, finding out ways we can foster that healthy microbiome, clear up those infections for you, and prevent future recurrence of these UTIs as well. We're going to link our Instagrams and ways that you connect with us in the description of this video. So we hope that you reach out, and we look forward to seeing you again next time. Take care, everybody.